Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be discussing benign prostatic hypertrophy, or BPH. This is a condition that affects millions of men, particularly as they age. If you or someone you know has experienced frequent urination, especially at night, or difficulty starting the urine stream, this topic may sound familiar. Joining me is my colleague, Dr. Bryn Henderson, an expert in regenerative and integrative medicine. Dr. Henderson, thank you so much for being here.
And thank you for having me.
All right. Dr. Henderson, what exactly is benign prostatic hypertrophy?
BPH is a non-cancerous enlargement of the prostate gland. It's located just below the bladder and surrounds the urethra. As the prostate grows, it can press against the urethra, causing urinary symptoms.
Is it related to prostate cancer?
No. While both conditions affect the prostate, BPH is benign. However, the symptoms can be similar, which is why proper evaluation is important, and it's concomitant in aging in every normal male.
All right. Name some of the things which cause the prostate to enlarge.
Okay, that's sort of easy. The exact cause of most are just aging, but that's not fully understood. There's so many hormonal changes in men as we age, it's particularly difficult to label just one, but testosterone plays a key role. Genetics, obesity, metabolic factors, all can contribute.
Okay, you mentioned testosterone. Is it high or low in BPH?
Okay, in the context of BPH, testosterone levels are not necessarily high. And in some cases, low testosterone may even be a risk factor. While testosterone plays a role in prostate development, BPH is a complex condition influenced by various factors, including aging, hormonal changes, and inflammation.
Okay, so then we have to talk about genetics.
Good. Genetics do play a role. In fact, family history is a significant factor. Men with a first-degree relative, like a father or son or brother, who have BPH are at higher risk. Researchers have identified genetic variations that may influence androgen metabolism, prostate growth factors, and inflammatory pathways, all of which contribute to the development of BPH.
What about early development? Are there factors from growth and formation that can influence BPH later in life?
Yes, the prostate forms during fetal growth, and hormones at that stage set a groundwork for its size and growth. Changes in this process, such as differences in androgen level, that's the testosterone, can increase the risk of prostate enlargement.
What are the most common symptoms a man would have?
These include frequent urination, urgency, which is going right away, weak urinary flow, difficulty starting or stopping your stream, and that lends to dribbling at the end of your stream, and the feeling that the bladder is not completely empty. Nocturia, which is waking up at night to urinate, is also very common.
How many times do the men wake up at night to empty their bladder with BPH?
Anytime men get up more than twice a night, it's pathological. They need to have evaluations. It is common to get up one time or not at all. And as we age, it increases. But anything over two, three and more, they need to get evaluated.
Okay, how do you diagnose BPH?
Well, we start with the medical history and the symptoms. And we just talked about some of them, including those getting up at night. And then it often includes a digital rectal exam, and those are supplemented by urine testing, blood work, and sometimes ultrasound to evaluate severity and rule out other causes.
All right, let's talk treatment options.
Treatment depends on severity. For mild symptoms, lifestyle changes like reducing coffee or don't drink fluids after 8 or 9 at night help tremendously. Medications often include alpha blockers to relax the prostate muscles and inhibit or shrink the gland. For more severe cases, minimally invasive procedures or surgery are needed. That's usually late, and it's because we haven't addressed it early enough.
Well, let's talk your area of expertise, regenerative medicine. What's your approach to BPH?
Regenerative therapies are still developing in this area with rapidity. The interest is in platelet-rich plasma, which we use for it, as well as regenerative therapy for improving prostate tissue health and reducing inflammation. These are not yet standard treatments, but it has been done with exosomes and others for assisting in reducing the inflammation. PRP is being explored as a potential treatment for some urological conditions, including BPH, and it's in research now. The injections have shown promise. The difficulty is making sure you have a good target, that you're not missing the gland. The disease progression is definitely altered.
So, what's the prognosis for patients with BPH?
BPH is definitely manageable, and in most men, the earlier the better. You can improve treatments tremendously. However, without proper management, it leads to urinary retention. The worst thing is it interrupts your sleep. That's when the brain cleans itself. So you've got to be sensitive to how many times somebody's getting up at night. In fact, most sleep centers should be tracking how many times they get up at night to void. And anything over 2, 3, and more, it disrupts the body's ability to clean the brain. So it's a big deal to get that bladder under control.
So, in traditional Chinese medicine, how would they approach BPH?
In traditional Chinese medicine, we approach kidney problems as the number one problem. And we also look at it in terms of balance in the body. And so it's a holistic approach, balancing herbal medicine and dietary adjustments to address the underlying imbalances contributing to the condition. This particular one are imbalance in the kidney yang and the damp heat accumulation.
What do you think about pumpkin seeds shrinking the prostate?
Well, pumpkin seeds may offer benefits for BPH, primarily due to their phytosterol and zinc content. These compounds can help reduce prostate enlargement and improve urinary symptoms associated with BPH. While more research is needed, pumpkin seeds are generally considered safe and potentially effective. It's a good natural lemon.
Well, what I use in my office and for my patients and my customers, if they go to www.askdrhelen.com and order natural progesterone, that shrinks the prostate. Now, you might say, well, doctor, you normally are a women's health advocate, and I am, but I studied this many, many years ago. First of all, I'd like to tell the audience that progesterone isn't male or female. Everybody knows that estrogen makes women look like women. Testosterone makes men look like men. Progesterone has no secondary sexual characteristics, can be used by both men and women. It heals the uterus, basically, and the prostate, which form at the same time in embryological tissues.
Yeah, it's an androgen, and it's related to DHEA. And DHEA is sort of the orchestra conductor.
Yeah.
It says how much androgen and how much estrogen. Okay, so there's no question it's usually very safe.
That's right. So let's do our mnemonic for benign prostatic hypertrophy care.
Well, no surprise, we use the word prostate.
P stands for?
Prevent bladder irritation. Limit caffeine and alcohol.
R.
Regular checkups.
O.
Optimize fluid intake, especially before bedtime.
S.
Symptom tracking.
T.
Timely treatment if symptoms worsen.
A.
Avoid medications that worsen symptoms. like decongestants.
T.
Target the medications or minimally invasive therapies.
And E.
Exercise and maintain a healthy weight.
Thank you, Dr. Henderson, for helping us understand BPH, benign prostatic hypertrophy, and the options available for patients. If you or a loved one has urinary symptoms, don't ignore them. Early evaluation can prevent complications and improve your quality of life. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.